Hello, everyone. My name is Brittany Miller, and I'm excited to be back for this week's session of the Raising Special Kids Facebook Live. We have a treat for you all today. So welcome for those just jumping on. Again, my name is Brittany, and we are here to talk about Arizona early intervention. So thank you again for joining us each week. It's been our pleasure to serve our community in this capacity, and we're grateful that you could join us. Before we get started for our topic today, I just wanted to talk a little bit about what Raising Special Kids has been up to this week. Of course, our phones have been ringing off the hook helping parents. We've had a lot of education calls, a lot of calls about helping families with our systems of care in our state, including early intervention, connecting families with support groups, really just being there, connecting them with parent mentors for empathy and emotional support. And we've really been grateful to be here for our Arizona families raising children with disabilities. We are still in our tax credit campaign. So if you're inclined to support our organization, it is an easy way to donate and get all of your money back. And we will put that information in the comments. The tax credit runs through April 15th. And even though our taxes deadline has been extended for the tax credit campaign, if you'd like to donate, it still expires on the 15th. So remember Raising Special Kids when you're thinking about the organizations you'd like to support. Please check out our class calendar. We have trainings scheduled through the beginning of June, and we'd love to have you. For NICU families, we have a support group that's on our website as well that we're facilitating, and our Nanette Salasic, our healthcare systems administrator, is doing that, and they have professionals and guest speakers, and it's wonderful. A lot of our NICU families end up being early intervention families, so it's very relevant to this group today. Check our website. It's twice a month on Thursdays. So with that being said, let's jump into today's topic. So first of all, I'd like to introduce our guest. Alicia Amundson from Arizona Early Intervention is back. She is our Part C coordinator for our state for AzEIP, and we're so grateful for her service. Alicia has served our Arizona community and working with families for 14 years and counting. She started out in the home working with families, and now she has had many positions at the Arizona Early Intervention office, supporting the providers and the families whose children receive these services. So thank you so much, Alicia. We're so grateful to have you here today.
Thank you so much. I'm really excited to talk with you today. I appreciate being invited.
Thank you. So before we get started on the questions we've gathered from parents, questions we've been hearing from our families, I just wanted to preface for listeners listening in that, as you know, we've been in a pandemic, and it's been over a year. And I've been so grateful to hear from families. All of us at Raising Special Kids have talked with parents and how they've been able to still have their services through AzEIP. Yes, we've done the teletherapy model, but the providers and the therapists have done a great job still making sure that the little ones in our state get the support they need. AzEIP has been working for many months now, planning for this day, when we're starting to talk about the reopening guidance and what that looks like. And so today, Alicia, if you don't mind, I've gathered some questions our family support team has been hearing from parents, and I'm just going to go down the list and tackle them with you, if that's okay.
Absolutely.
Great. And families, I am watching the chat, so if you have a question that you have pop up, please put it there, and if we have time, I will definitely address it. So to start off, Alicia, can you just provide a quick overview of the recently published AzEIP reopening plan and some of the key points families will want to know about?
Yes, absolutely. So when we think about our reopening plan, we have a framework for all of our service providing agencies. That would include our early intervention contractors within the various AzEIP regions, our Division for Developmental Disabilities, service coordinators and districts, as well as our counterparts in the Arizona Schools for the Deaf and Blind. And so within that framework, we just outline some pathways for our teams to support resuming limited in-person services for families that are being served in early intervention. The framework is really based on the benchmark data that is released through the Department of Health Services website. So all of our local service providing agencies are going to be taking a look at some of that information that's coming from Department of Health. There might be county or tribal ordinances that are related to, what is available in terms of opening or, being present in different vicinities. And We also outlined some of the expectations around what we want those in-person services to look like if there is a safe pathway for that within a local community. So we released that guidance to our service providing agencies on March 8th, just to give them enough time to ramp up, make sure that all of their team members are trained, make sure that they have safety protocol in place and those types of things. So when as they're ramping up, families should start to hear from some of their service coordinators or service providing agencies and have some of those discussions on what might work individually with families. We also sent a letter to all of the families that are enrolled in early intervention, whether they're in the referral process or whether they are currently receiving services, just to be sure that we had multiple ways to connect and kind of let everybody know what's happening. We're also really grateful for Raising Special Kids because I know that as families are being referred into AZIP, you all have been working to let families know what's happening with that. So that's a broad overview of what we're looking at with the framework.
Thank you. And we actually have these guidelines on our website. So we'll go ahead and put those in the comments. So families, please take a look at those so you understand, how it works and the safety precautions and what it might look like for your child resuming in-person services. It's very family friendly and we encourage you to check it out. Okay, so let's go on to the next question. So we've heard this quite a bit, honestly. What will determine whether or not a family can receive in-person services for their child?
Absolutely. We have heard that question a lot as well. So that's a big one for everybody. Really, our primary consideration is still that we want to be sure that everybody that we're interacting with continue to be safe, right? So when we think about the work that we do and our providers travel, in the past, they've been going into homes, and we do often work with children who might have medical conditions or have a need for very extreme safety protocols, even when there isn't a pandemic. So we want to be really thoughtful about the safety. That really is continuing to be a primary factor. So when we talk about safety, there's a couple of things. We want to look at the local community and the level of spread. Our providers will be monitoring that data.
Okay.
But beyond that safety aspect, one of the key considerations that we've asked our programs to consider is what has access or consistent services look like for families, individual families. So I'm sure many of you out there, your child in early intervention may not be the only child that is trying to receive some type of service. And so we've interacted with families who might have 2 or 3 kids where we're trying to balance virtual learning for school age in addition to participating in early intervention services. We've encountered families that have limited access to internet or limited access to some of the materials for virtual visits. So when we think about considerations, we really want to consider, of course, safety first, but we also are looking at for families where they may not have had the same level of access or requested to reduce services because it became too much, juggling everything. So we want to really think through that. And we also want to think about whether or not some of the outcomes are being met by providing alternative services. So the reopening guidelines, we've indicated that this is not like a light switch, right? So we want to make sure we're phasing this in, continuing to monitor, continuing to be sure that all of our families are safe. And so teams will be considering, access. They'll be considering whether or not we've been successful, because there have been a lot of instances where services are going really well and it feels that, children are progressing. And we also want to consider some other individual factors that families may be facing. So we're really thinking through this from an individualized perspective. It's likely to look different for every single family because that is foundationally our role, whether or not we're in a pandemic. So that's
Right.
some of the considerations.
Thank you. And that's good to point out, on the IFSP document, it looks different for every child. And I really am grateful that your agency and then the therapy providers and service coordinators are going to look at it as, how has this family been doing this past year with teleservices? Have they struggled? Have they been doing well? And then take that into consideration when determining what the future will look like. So thank you for pointing that out.
Mhm.
We know that safety is a huge precaution for families and for the people, the therapists coming in. Will the therapists or service providers have, safety standards they have to meet? Will they have to wear masks? Things like that.
Mhm. Absolutely. So, if you all are very interested, you can certainly take a look at the guidance document that was posted in the chat. But we will expect all of the service providers that are connecting with families in person to absolutely wear masks. We are continuing to recommend or require that we are following the CDC guidelines in terms of, physical distancing and, just making sure that we're following all those protocol. Um, it's really critical for us to continue to promote those safe interactions. We've heard a lot of conversation about with the vaccine and a lot of people having more access, or some people may not be able to get the vaccine because of medical issues or anything like that. So we want to be really thoughtful about those safety precautions and continue to utilize those. For family members, we would expect our teams to also consider any additional safety protocols. So again, kind of going back to the individualized support. So, things like being sure that there's an opportunity to wash hands or, use hand sanitizer, making sure that the masks are appropriate. Sometimes we would consider limiting the number of people that are interacting with a visit, which is a very hard thing for early intervention because, sometimes we have therapists joining at lunchtime and it's a family affair to support a child within that outcome. So we're really thinking about how can we effectively meet the needs, but still continuing those safety protocol. Within our guidance document, we have indicated that, if you were to encounter a team member that, wasn't wearing a mask, you have the right to refuse to visit or reschedule. And we would also ask that families will support with those safety protocol as well. Just kind of going back to, we do visit multiple families, so we want to make sure we decrease the risk of spread.
Sure. And on that note, so will it be required for the parents to mask up and their child to mask up for the service coordinators and the providers to come in the home? Will that be a requirement?
We would ask to follow the CDC guidelines,
Okay,
knowing that we work with infants and toddlers.
sure.
That's not really in the in the stars for us. That's not safe for the children that we work with. But
Sure.
we do ask that families follow some of those CDC guidelines as well, just so that we can make sure everyone is safe and we reduce the spread and continue to be successful as we're looking at our reopening.
Thank you. So just to clarify, so if my child was in early intervention,
Mhm.
I live in a community where we've met the safety benchmarks and it's okay to resume in person. Will the therapy provider be kind of initiating, talking with me as a parent and setting
Yes.
up what that'll look like, phasing back in?
Yes, absolutely. So our office, and with the support, of course, I have to mention, we have had a COVID task force that has been meeting regularly for many, many months, just to be able to take into consideration all of the perspectives. So I'm grateful Brittany's been on that task force since the beginning, but we have family representatives and representatives from all of our service providing agencies. Um, so with all of that being said, the framework is really a broad frame so that everybody kind of knows how to operate. And then there are local considerations. So families should expect to hear from their service providers, whether it's the service coordinator or the local agency.
Okay.
They'll be reaching out to connect with some of those details because like I said, there are differences across the state, not only in spread, but sometimes there are county requirements or travel requirements and just different things that each agency has to take into consideration. So definitely reach out to your agencies and they'll have a little bit more detail on what that looks like for your area.
Perfect. Thank you. So, Alicia, some of the companies that have been providing, DDD therapies, or, my daughter receives nursing services. They've had they've sent a message out prior to a therapist or a nurse coming in our home, or they've required us to answer some screening questions about COVID. Is anything going to be implemented similarly in the early intervention program?
Yes, absolutely. So that is also outlined in our guidance document. We
Okay,
did provide a couple of sample screens or checks, both for providers and for families. So again, we really want to make sure that we are maintaining those safety standards and continuing to keep us all healthy. So the service providing agencies are encouraged to have that a health screening, and it could look a little bit different depending on the agencies that are involved, but both for providers and families, just to be sure that, again, if a service provider is feeling that they have some symptoms, we would want to be sure we're not going and doing visits with
sure.
families. So,
Definitely. And it seems there's, two groups. Some families with understandably are anxious and kind of seeing the light at the
yes.
end of the tunnel of, possibly having in-person services again. And some families, they may have medically fragile children and they're not ready yet. So I'm glad that your organization is addressing, both populations. So
Mhm.
on that note, is there going to be, well, you've kind of answered the question already, but there's been some guidance in the document for the provider agencies. Will they be training their staff on, what to do, how to resume in person, all of that?
Yes, absolutely. And that was a really critical part of that time frame for the provider agencies. So, not only did they have to kind of digest the framework, they needed a little bit of time to develop a plan with their agency, make sure that they're supporting all of their team members and training them on, their local agency protocol. Giving, I've heard some agencies talking about, developing some talking points and making sure that they're connecting to families in a certain way. So, that definitely was a part of that time frame between March and our starting time on April 9th, just to be sure that providing agencies had the chance to do that.
Thank you. So
Mhm.
for families that are approved for in-person services, if they're not ready to have a therapist come to their home, would it be an option to do like the park by their house or go to a clinic? Is there any flexibility there?
Well, again, and this is the beautiful thing about early intervention, we would encourage that, irregardless of having a worldwide pandemic, we really are. Our program is intended to provide services where children are, right? So
Right.
that's a factor. When it relates to this, we've been really thoughtful, and that's why we're saying in person, because so personally, if I were receiving services in my home right now, I don't think that I would have a space that would allow for physical distancing or those types of things. And so we want to be really thoughtful when we say in person. That could mean a park. It could mean, some kind of an office. It could be the backyard, front yard, whatever works for the individual situation. And of course, when we think about the safety protocol, being in that open space, reducing the likelihood of droplets, being transferred between individuals, that's really critical. So we would love to see lots of visits that are happening, in the backyard or in a park. We encourage that irregardless, and it really is such a great learning opportunity when we go on visits to the parks anyway. So in person means in person, but it could mean all kinds of different locations. So
Thank you. Those natural settings for kids. I remember we were getting PT at the park for a while and
yes.
it's enjoyable for them anyway. So good to know.
Oh yes, it's easier to learn when we don't feel like it's work.
For sure. Adults too.
Yeah.
So so teletherapy has been, convenient for many families. And I know, the option to have, doctor's appointments over Zoom or over the phone or, our therapies that way. Do you think it's here to stay? Do you think we'll always have that option for early intervention?
It's been really interesting because I think initially we had that major pivot where every single industry and services and schools and physicians, we all had to rethink the work that we do. Being that it has been effective, we do expect to continue. At least into the foreseeable future, some options for telehealth or tele-intervention services for us. Primarily, there are times when, and I think that this could be a viable solution for sometimes families, when it's RSV season.
Sure.
right? And thinking about that in the future. Of course, I can't predict entirely what will happen, but we had been looking at options for teleintervention prior to the pandemic. Some states have implemented those methodologies for services and early intervention as well. So while it's not officially in our policy and procedure, we do not anticipate taking that option away. So we want to just be sure that we're being flexible and supportive, and where that has been successful and it helps with safety for children, we definitely want to encourage that.
Thank you. Our world has definitely changed this year, but I feel like teletherapy is a positive, something positive that's come out of it that's been an option for families. So I'm glad it's here for at least a little while for AZIP. So that's
Yes,
awesome.
absolutely.
So, when a parent calls central referral or a doctor refers a child to, early intervention,
Mhm.
when the assessment or the intake call is taken, and then, the therapy agency is assigned, and then they contact the family. Um, I know that the assessments lately have been virtual. Are they going to start resuming in person again?
Really, that will be dependent on the framework and kind of where it's at. So, when we think about the in person services, that does include, let's say, the entire process. However, things like evaluations and assessments, sometimes it requires two individuals. And so it might look a little bit different initially. And of course, depending on the local spread and different things that are happening. But we would want to see, if all the requirements are met and the team determines that's the best solution, we likely will see some of those things opening up or easing in a little bit more in the near future.
That's good news. Thank you. So, we've had this question pretty often at Raising Special Kids, hearing from parents. And, some families struggled, as you know, sometimes teletherapy is hard. And so maybe they took a break because it was stressful because they were doing online school with their older kids, or trying to
Yeah.
work and be mom. And it's been difficult. And so maybe they slowed down their early intervention services, or maybe they took a break. Will
Mhm.
there be any opportunities for families to, make any of those services up?
Yes, I would encourage for families that are in that space of, okay, we slowed down for a little bit, but I would like some additional help. We've been encouraging our teams to just make sure they're having those conversations with families, and if it seems like an increase in certain services are appropriate for that particular child and family, we would encourage a review of the IFSP so that we can include a burst of services. That way, we're kind of resolving some of those questions or concerns. And I also, this wasn't quite a part of the question, but just to address, we know that some families actually exited early intervention for a time and would like to come back and be re-referred. And so really, I would encourage all families to connect with your team. If we have families that are listening who have exited from early intervention and are looking at coming back, I think just having some of those conversations and saying, you know what, here's kind of what we're looking at. This is what's been happening. Here's where we need help. And then that way we can look at, those individualized supports to help families move that forward. So,
Thank you. And for families listening in, if you would like to refer your child to early intervention, or get back into the program and have them assessed, we can put the phone number to central referral in the chat. I do know it by heart. It's 602-635-9799. And please call. You families, you can refer your child. Often doctors' offices or social workers will, but you do have the option of referring your child as well. And if you have questions about any of the topics we've discussed today, please communicate with your teams. We at Raising Special Kids, we always coach families on being collaborative. So as Alicia shared, talk with your service coordinator, share your concerns. And if you need help with that, at Raising Special Kids, we'd be glad to support you. So we will put our
mhm.
information in the comments, and we can talk you through your concerns. If you have any questions about what we've talked about today, we can clarify them, and of course, connect you with the AZIP office if that's needed. So, keep that in mind for parents listening
Mhm.
in. So to wrap things up, Alicia, just a final question. What would be some, words of advice you may have for families on how they can work together with their early intervention teams, and, to help support creating a smooth transition back to in-person services whenever that may be?
Yes, absolutely. I think the best thing to do is to just continue to communicate with your team. There's no one size fits all approach, and I feel like allowing all of our, whether if you're listening in as a provider or listening as a family, I think allowing that grace to say, you know what, this might work today, and there may be a time in a month or two where we say, I don't feel like this is happening, or, maybe we want to go back to tele-intervention, or maybe we need to take a look at what our in-person services look like. And so I think that ongoing communication and collaboration, families are team members. And I know sometimes when we get started in early intervention, it can feel like, this is overwhelming. I'm surrounded by a whole bunch of professionals who do this all day, every day. But I really want to encourage families to feel comfortable to tell their teams, like, okay, I don't know what this is, but for some reason this doesn't feel right. Can we adjust? Can we check in? We would expect our service coordinators should be reaching out to families on a monthly basis just for a check-in. Those are really great opportunities to share, okay, this is working well. I don't know about this. Can we adjust? And things like that. I think just being really open about what's happening with you and your child, and just, sharing with the team. We would expect our teams to continue to work through that as well. And so we've, talking to some of the providers, and we say, you know what, you might say, you know what, once a month I want to have an in-person visit. And then you find that, this isn't working, we got to adjust. So just allow that time and open communication. We really want to hear from you. We want to hear what things are working well, how we can improve, and what we can change to make it better. So just keep in touch with your service coordinator and keep talking to your team, and move things forward. Families know their children better than we do, right? So we need to make sure that we have that encouraging space for families to participate as a team member. And then also, we love to hear from you and really understand what's happening.
Thank you so much,
So yeah.
Alicia. That's such good advice. And I did want to note, you are having listening sessions, right, coming up?
Yes. Thank you so much. We do have a listening session that is going to be on April 6th, that is in English, and April 12th in Spanish. Every family who is in early intervention should have received a letter. However, in the chat, if you, for some reason, don't have the link or don't have the information, feel free to let us know. The listening sessions we will be in a similar fashion to this, but with perhaps a little bit more detail. We're going over the framework. We're going to talk a little bit about what in-person is, what benchmarks are we using, what does this look like? And we really want to hear from families and have that opportunity to engage on that level. So we really want to see good turnout. If for some reason you don't think you'll be able to make it to the family listening session, don't hesitate to reach out to our office and ask any questions. Our team is really ready to help with anything that you need. And our email address is AzEIP2, so it's ALLAZEIP2 at azdes.gov. And I have this phone number memorized, but our phone number is 602 532-9960. So, if for some reason you can't attend the family listening session, and you have a few questions and you've been working with your team, don't hesitate to reach out to us. We really want to make this entire transition smooth and hopefully clear up any of that anxiety that is out there about what this will look like. So.
Thank you. And families, we will get a hold of the links to those listening sessions. We'll put them in the chat later, and also we'll share them on our social media so families are in the know about what's going on, because it's important to share your parent perspective. So please, take advantage of that opportunity. And I just wanted to say thank you on the behalf of our team. We're so grateful for the continued support your team has been to our community and families. And like you said, trying to diffuse some of that anxiety and just giving families a place to share their concerns, and then trying to come together on what's best for the provider agencies and for the parents and for the children that are in the Arizona Early Intervention Program. So thank you for all of your hard work.
Anytime, and we so appreciate the partnership. So feel free to reach out to us, and You know, for families that are out there, we hear from our counterparts at Raising Special Kids often. So whether you're contacting us or contacting Raising Special Kids for help with navigating, we do work really closely together. So we love to hear from you and get that feedback.
Thank you. And just to wrap things up, thank you so much for everyone listening in. Again, if you have questions, please call us at Raising Special Kids. Communicate with your child's team and just know that we're here for you. And again, we will post the listening session information once we get it. We'll share it on social media. And please feel free to reach out to us or the Early Intervention Office, and we're happy to support you. And with that, everyone have a great weekend. Thank you.
Thank you so much.